let us go on with our studies. And so you see that, we are going to present procedures. This is the new unit 3 of the course book. And so actually procedures are very commonly used in medical practice. So different kind of procedures just to do some research, examine the patient, or take some tests, or some treatment procedures. And of course, every doctor should know how to carry out the procedures. And so we'll also discuss instructions to the procedures. So before we start doing this, let us focus on the previous home assignment. That you've done for this class, yes, actually last week. And you remember that the task was to watch a video and to complete the form in the text file. And everything was great, but there were some mistakes. I found some mysterious phrases and some students' papers. Here are the screenshots from the papers, and this is about the symptoms that the patient in the video experiences. He's speaking about cough. So this is his chief complaint. But the other symptom that he was speaking about, one of the students wrote soft throat. It's good that the student understands this is about pain in the throat, yes, but he doesn't remember the exact spelling of this term. The other students have even written about food, sauce food. Of course, it's wrong. If you don't know, if you are not sure about the spelling of the word, so what should you do? You should consult the dictionary. So that is why, so please be careful about this, and you can see the correct spelling of the word. It should be sore throat. I guess most of the students have done this correctly without any problems. Well, and yes, 10 points, most of students. Do you have any questions about this homework?
No questions.
Good. Well, now if we move on. Yeah. Just here we can see 3 pictures illustrating some what is happening in a hospital, and we should answer the questions. So Tala, hello Tala. Yes. And
Yes,
we
teacher.
We should answer the question, what is happening in the pictures, and what do you think happens before and after? If we look at picture A, what is happening here? Abdel Rahman.
In picture A?
Yes.
Okay, doctor, we can see a person and also a doctor, and doctor tell this person to sit in the bed to make some examination and yeah, to know what's the problem with this patient.
And you can see the doctor is holding a piece of clothes in his hands. So
this cloth?
Yes, I guess so. This is like some medical clothes. Maybe he's asking the patient to undress and put on these clothes and just to examine the patient.
Maybe this type of examination want to
yes,
to wear this clothes. Yeah.
Yes, right. Okay. Well, great. So, and in picture B, let's listen to Ahmad. What is happening in this picture?
So picture number B, there's a doctor that's writing down some patient information, medical information,
Mhm.
and yeah, I think she's transcripting it from another paper.
Mhm.
Yeah.
What do we call this paper with the information about the patient? What is it called? Case history, right?
Yes.
Yes. And you see there's a lot of papers
Yeah,
on
a
the
lot of cases.
on
Yeah,
the
history
table.
cases.
Maybe the case histories of other patients, and so.
And other patients.
Mhm. And what did she do? What happened before she started writing?
Yeah, before she's starting writing, she might be exam some patient and yeah,
Yes,
get
right.
the right.
Just to get the information about
information.
the condition of patients, and now she's putting on the information, all the information on the paper. Okay, good. And
Yeah, and she writing
yes,
it to memorize it.
yes, exactly. Just to memorize herself and maybe to keep information and then to give information to other specialists or doctors about.
That's the function of the case history.
Exactly, you're right. Okay, thank you. Now, Zaina, picture C is for you.
Okay, so in picture C, we can see three doctors. One of them is working. I'm guessing this is the more professional doctor or an expert doctor. He's doing a procedure, and the other two doctors are just watching him to, like, I think, to learn. Maybe they're new doctors or they don't know much as the professional doctor. So they're like understanding what's happening and how things go.
Mhm. And what will happen after this?
They will, I think they will take notes and then they will be asked about what they have learned and they will apply, I think.
Apply their knowledge. I think they will try to do the same procedure themselves, right?
Yes,
This is
exactly.
that is why they are here. Okay, great. And three more pictures. And picture D. Manzil Hussein, please. No. Mohammad Viam.
Yes, doctor.
Yes, please.
So they are checking the patient, sorry. And there's someone visiting him, I think.
Who is visiting him?
Maybe his dad.
Relative.
Yes.
Yeah.
Yeah.
And where are they?
At the hospital.
What do we call this this place in the hospital? Yes, Mohammed.
I think it's the medical room for the examination.
I see. Okay. And the doctors, the same way as you, they are smiling just to calm down the patient, right? To encourage him. Well,
Yes,
and
so he's getting better or something while seeing the doctors happy or something.
that yes, that the patient is getting better. Yeah. Well, we're happy for him. And now, so picture E is for Sadin, please.
Yes, in this picture, I can see a doctor and I think a nurse. They're talking maybe and discussing about one of the cases of the patients that were before.
Yes, we can see maybe one of them is holding some papers,
Some-
maybe with what? Notes or
Or
results of
medical
some
information.
tests.
Yes.
Yes, some information, right. Well, yes, this is a medical practice is a teamwork, and it's always very important to discuss the cases together, just to clear out some ideas, just to get some ideas from other people, other specialists, medical specialists. And so picture F now, Tala, are you here? Tala?
Yes, teacher.
So what do you think of picture F? What is happening in this picture?
Well, there are two doctors, and I think they are examination and verifying the information about the patient. And I think the doctors see the another doctor's report and gives him some information about the patient.
Okay, and why is one of the doctors yawning? What do you think?
I think it's about the doctor is responsible about the patient.
He's tired. Why do you
Yes.
think he's tired?
Because it's the responsible doctor about the patient and about the efficiency about the patient and because it's about the him.
Mhm. Too much stress. Yes, that is why he's tired.
Yes.
Or maybe the doctor has finished his shift, and this is the end of his shift, and he's discussing what happened during his shift with the doctor who has just come in the morning, for example. And so he is giving the information just to another doctor about the patients and their treatment.
I think it would be the doctor responsible for a patient case in the hair shift.
Okay, yes. Good, thank you. Well, and so if we move to the next slide, we can see there is definition for the word ward. A ward. A ward is a separate room in a hospital, so typically allocated to a particular type of patient. Like in picture D, this is a ward in a hospital. And I would like you to think of your own experience in a ward for the first time. Have you ever been in a ward as a patient, or maybe sometimes as an assistant, if you have any experience? So Zeina, please.
I think I have been in a ward when I was young because when I broke my arm, so I was in a surgery, and then after the surgery, they put me in a separate room for like a couple of weeks.
And do you remember, so I mean, how the doctors helped you? Were they useful?
Yes, they kept passing by, tried to make me more comfortable, feel more safe. They checked up on me and they just made me optimistic and tried to give me good news.
Yes, and did it help? I mean, feeling just optimistic, and so did it help in your physical treatment?
Yes, of course, it made me heal faster because I knew that I'll be fine soon.
So very good story. So it shows that it's very important to be positive in a hospital for doctors, though the patients are sick, they are ill in serious conditions, but the doctors should always encourage the patients, and it will help in the treatment. Okay. And one more word is term is the ward round. This is a visit of a doctor in a hospital to each of the patients in a ward. So the doctors in a team several doctors, a doctor, for example, and a consultant and a nurse, they go around the hospital they enter the wards and they discuss the process of treatment, the medications, different kind of procedures. So, and it's normally done in the morning, and it's called the ward round. The same as we see in picture D. So this is a ward round. And if we speak about ward rounds, we are going to listen to, we are going to just look at the tips, 5 tips that an experienced doctor gives to junior colleagues about ward round. So let us look at these just tips, read them, and answer the question. Why do you think each tip is given? Why is it important to remember about this? Well, we stopped with yes. Let us listen to Khalil. Khalil?
Yes, doctor.
So please, line A.
Okay, make sure you know the names of your patients and where they are. Yeah, it's important to like build maybe a relationship between the doctor and the patient to like help each other more to like build a strong relationship between them. It will be better for the treatment.
Yes, yes, to calm down the patient. So
Exactly.
okay, good. And now line B is for Muhammad Aib. Muhammad Aib, hello. Where are you?
Yes, teacher, I'm here.
Yes, please. Line B is for you. Read it, please.
The B.
B.
Sorry, teacher. Can you repeat?
Will you please read line B?
Okay, teacher. Line B is about find out from the bed manager if any patient have been moved and to where.
Why do you think this tip is given? Why is it important to?
It's so important to know about that.
Why?
Because teacher, you should know about the patient's room number, that where is this patient and when you should meet, like in the morning when the doctor want to see the patients. You must know about the rooms that where the patient is, and if this and the room is comfortable for the patient or no, or the things that is need for a patient is in this room or not. For this reason, it's so important for a patient to be in a specific room.
Okay, yes, good. So now Muhammad Aib, what about line C?
Line C, check that all the case notes, investigation, and so on are on the ward. Yes, when the doctor visiting a patient, he need to know about the case notes, like his story, and when some other doctors come to check his blood pressure, like other tests, like this is so important for the doctor to have the notes on the table on the ward.
Yes, just to check the current condition of the patient with what was written previously. Okay, Mohammed Nabil, the next line is for you.
Invite a nurse who knows your patients to come on the ward rounds. Yeah, maybe for this for the patient, because he will not feel weird if he saw his patient with the doctor. So, and also the nurse will help the patient from before coming of the doctor. So maybe he know her and she know him. So yeah.
Yes, right. So sometimes nurses spend more time with the patients than doctors. They just carry out the procedures. They bring them medications and so take care of the patients. And they know the patients better. Okay. And the last line is for Lali.
Record case histories and results clearly and concisely. This is very important because like if we make any mistakes or if we like don't write something, it could be bad for making diagnosis or predicting what could happen or predicting when this patient could like be perfectly treated and be like he can when the patient can go like leave the hospital. These things are very important for these kinds of things.
Yes, for the further treatment after dismissing from the hospital. Right, and
Yes.
also these the case histories can be used by consultants, by other doctors, so they should easily get the information from these papers. Okay, thank you. Now, if we move to the next slide, just a minute. Yes, here we can see that one doctor, one of the experienced doctor, is commenting on each of these tips, and we should listen and complete each tip with several words, but not more than 5 words. You can see that this is the explanation why each tip on the previous slide is important. Like if we have a look at the, just make sure you know the names of your patients and where they are, as you want to demonstrate that you are, and you should add some words after this phrase, after each phrase. If you have the book, so in front of you, you can find page 20, the beginning of unit 3, and so you may use exercise 1 and exercise 3. So the beginning of sentences, the tips are given in exercise 1, and this is exercise 3. Now I'm going to turn it on, and you'll tell me if you can hear.
The bed managers, if any patients have been...
Unit 3.
Yes.
Can you hear?
Yes, we can.
Yes.
Okay.
Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
And now for the second time.
Unit 3. Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Well, now, so what did you say about the knowing the names of the patients? Is Abdullah here?
Yes, Dr. Amir.
So what did you write in line A?
I write, make sure you know the name of your patient and where they are, as you want to demonstrate that you are familiar with your patient.
Exactly. Yes. Good. And the next line is for Aun. Line B, Aun.
Yes, doctor. So it's find out from the bed managers if any patients have been moved and to where to avoid wasting time.
Yes.
Refer to them quickly.
So you didn't write anything? So
No, I write looking for patients.
looking for, I see,
and-
okay. Yes. So to avoid wasting time, especially the consultants running around looking for patients. Exactly, good. And so the Abdelrahman now. Line C. Abdelrahman Moussa Mahmoud Hamed. Hello?
Yes, doctor. Refer to them quickly, number 3.
Yes, so you can refer to them quickly.
Yeah.
The next is for Ahmad. About nurses. Ahmad, hello.
Yes.
Line D, Ahmad.
Line E.
D.
Okay, record. Yeah. Record info that way you can, because they may be more knowledgeable about excuses. So the patients on the ward.
Yes, the patients on the ward than you are. Okay. And Zaina, please. The last line.
Yes, record information, and that way you can access the information easily.
Exactly. Okay. So I think these are rather useful tips for the ward rounds.
Unit
and,
3.
Would you give the same tips to a junior colleague in this situation about starting a ward round? Or what additional advice would you give them? So who can answer this question? Yes, Zena?
For additional advice, I would say that show the patients that you actually care about them and that you will support them whatever happens, and that you will always update them with anything new that might happen. Ask them about their feelings, how they feel, if they need any mental support, and tell them that you're here whenever they need you. So just try to make them relax.
Very good piece of advice. Thank you. Okay, does anyone else want to say something? No, I see. Okay. Yes, please. Who is speaking? What's your name?
Mohammed Nabil.
Okay.
Yeah, talk with them with easy language so they can understand.
Yes, it's very important. Yes, you remember we were speaking about non-technical language that we should use in the conversation with the patients so they can easily understand us. Yes, the doctors, I mean you, not me. Yes, right, you are. Any other advice? Mhm. Okay, so there is, yes, I see that we have about 1 minute left. So I guess we can take a break